All right, good morning. I'd like to officially welcome you to the Stanford Health Care Nurse Residency Program Application Preparation webinar. Again, my name is Kerry Zoss, and I'm the Nurse Residency Program Coordinator, and it is my honor to host this session for all of you, and I thank you for joining us today. We have three main objectives for today's webinar. The first is that you, the participant, will leave today's session with a greater understanding of the application process and expectations for the candidate. Our second objective is that you, the participant, will be able to have a heightened understanding on what we're looking for in cover letters, resumes, and our electronic application, as well as what the 4 application requirements are for our residency program. And then the third objective is that you just have a better understanding of our program as a whole. So what is the timeline for our fiscal year 2022 cohorts? What units and departments are hiring? What is the participation? What is the volume? How many people are we expected to hire? And what is our current retention rate? And then what is the nurse residency program? What is the curriculum? And what should I expect? Should I be hired into this program? It takes a village to run this program and to do this work. So I am not here alone. I am joined by some exceptional individuals within the Stanford organization. The first two are Kevin Silvestre and Carly Dye. Both are my colleagues in human resources. Kevin is the manager of talent acquisition, and Carly is our senior talent strategist. So they work on the recruitment side, working with potential candidates, assisting my team in screening applications, and really building that pipeline of talented professionals into our organization. And then I am joined by 4 exceptional current nurse residents who within the last year were in your shoes applying to the program and going through this process. And they are here today to really answer your questions. They have the most relevant experience and can relate to what you're going through, as well as provide insight onto what's next as they are currently walking where all of you will be walking in due time. So first is Edward Cow. He's a clinical nurse on BMT CAR-T. He will graduate on Monday from cohort 33. So he has completed his 1-year residency at Stanford Health Care. The second is Shane Yoshiyama. He is a colleague of Edward's on the same unit, BMT CAR-T. He is a member of cohort 34, a little over midway until in his professional first year. And then Afreen Patel, who's a clinical nurse in the liver kidney transplant unit, and Meley Abraha, who is a clinical nurse in our trauma surgical ICU, are both members of cohort 35, which is our most recent cohort. So all these individuals are joining me today. We will have a robust Q&A session. So I ask if you have questions, especially for our residents, if you will put those in the chat at any point, and Kevin and Carly are going to manage the chat, and then they will read those comments or questions during our Q&A portion. So who are we as the Stanford Health Care Nurse Residency Program? Well, we are an American Nurses Credentialing Center, a nationally accredited transition to practice program, meaning we take newly graduated nurses who have nursing education but minimal nursing experience, and we support you in that transition to clinical practice. We have designed a program for highly motivated, determined, and compassionate new nurses that includes over 300 hours of direct clinical orientation with a dedicated preceptor and supplemental education and training, whether that is didactic or immersive simulation, in order to make your first year of transition very successful. Our curriculum, our program follows Vizient, and we integrate their 3 principal domains of leadership, professional role, and quality outcomes. And then our whole program, in essence, is guided by Watson Caring Science. Really, the goal of our program is to develop you into competent, compassionate, and committed clinical nurses who make a positive impact in the lives of our patients. So this is just a snapshot of our curriculum. Again, we are a Vizient aligned program. And so what does that mean? So years ago, academic medical centers, we're seeing that new nurses were not staying within their first year of their professional career. So academic medical centers partnered with schools of nursing, and they said, why are we seeing this exodus within the first year of professional career? They got together and they created residency programs, really to support new nurses in that first year of practice. The goal of our program is not to reteach you what you learned in nursing school. You all come with solid skills, experiences, and education, and our goal is to build upon that and to show you the application of all those skills and abilities and knowledge and get you to apply them at the point of practice, meaning with the patient in the clinical setting. We focus on leadership, how you communicate, how you escalate, how you delegate, how you teach patients, how you resolve conflict. We talk about patient outcomes. We look at the changing patient condition. How do I manage a patient from deteriorating? What does it mean by failure to rescue? What are my resources? How do I appropriately address pain? And then we look at you as the professional and how we can develop and grow you. First, how do you take care of yourself? How do you manage stress? What are your professional and education goals, and how can we get you there? And then we invite you to participate in evidence-based projects to really grow that inquiry of you asking, why am I doing what I'm doing? And then we pose opportunities for you to look at ethical decision-making, social determinants of health, implicit bias. What does it mean to take care of an end-of-life patient? What does it mean to be really culturally competent? And we do that throughout your 1 year in the nurse residency program. The 4 main buckets of our program include a very robust clinical orientation on the unit in which you were hired in with a trained preceptor. The second bucket is seminar classes and simulation within the nurse residency program, facilitated by the nurse residency program faculty. The third is allowing you to participate in an evidence-based project with members of your cohort under the guidance of a clinical nurse specialist. And then the fourth is creating a structure of supportive and collaborative meetings that include your leadership team, your education team, your clinical nurse specialist, and a member of the nurse residency program. We know Stanford is a really big place, and the first year is really integral into your success. So we want you to feel supported and mentored all through that first year. We're really excited that our volume of nurse residents has exponentially increased over the last couple of years. We're not only growing our program by number, but we are also expanding our program, and nurse residents are being hired into areas in which we did not previously hire into. So you can see, even from fiscal year 2018, which we only hired 20 new grads for the entire year, and now we are projecting to over 200 nurse residents for our fiscal year 2022, which are our cohorts in March and August. The other thing we're really excited about is our retention is holding. So as much as we want to recruit you into our organization, we also want you to stay within an organization and grow within our organization. And we're happy to say that we've maintained above the 80th percentile since fiscal year 2017. So where are we hiring for our March cohort? For our March cohort, we are hiring into all of our inpatient areas. So that is all 6 ICUs, that's trauma, cardiac surgery, cardiac medicine, neurosurgery, medicine, and oncology. We have 6 oncology units that are hiring. So that's BMT, oncology, and hematology. All of our medicine units are hiring: general medicine, advanced lung disease, cardiology, and neurology. All of our inpatient surgical areas: cardiac surgery, thoracic vascular surgery, liver kidney transplant, trauma surgery, orthopedic, neuro, urology, hepatobiliary, and surgical oncology. Our float pool is hiring. Now this float pool is the oncology, medicine, and surgical float pool. They do not go to the ICU. So you are trained to take care of patients in oncology, inpatient medicine, and inpatient surgery. And then our inpatient psychiatry unit, which there are 2, but they're under kind of one head. So you could work in either the voluntary or involuntary unit, is hiring. For the first time, we are expanding into our interventional platform space. So that is our operating room area. And we are hiring into the pre-op and PACU recovery areas. Again, one umbrella. So you are not hired into pre-op and you're not hired into PACU. You are hired into both, and you will be trained in both, and you will work in both. And then we are hiring into our nursing research department under the clinical trials domain, which we're really excited about, but this is the area we get the most questions. So people say, what does that mean? Does that mean I'll be doing research? And the answer is no. So Stanford is an academic medical center. We are on the forefront of innovation, and all the work we do is rooted in the evidence. So you can believe that on every unit you step on, there is some sort of clinical trial happening. Clinical trials take a high degree of skill and oversight in order to manage. And so individuals who are hired into this department are trained to manage inpatients who are undergoing a clinical trial. So this is a patient-facing, direct patient care position in which you will care for patients who are admitted into our organization and at the same time undergoing a clinical trial. So perhaps one day you're going to be working on E1, bone marrow transplant, and there is a patient undergoing a clinical trial and you are taking care of that patient. And then the next shift, you're working with a patient who is in cardiology, who's getting a new medication, that is a study, and you're managing that patient. If for some reason there are no clinical trials at Stanford on a day that you come to work, you will work as supplemental staffing similar to our float pool. So you will take care of a patient or patients in oncology, inpatient surgery, or inpatient medicine. If you are passionate about research, if you're passionate about innovation, if you like to see the alignment of innovative work at the bedside, then this is the spot for you. So this is our timeline, really busy timeline, but the reason I present this to you is for full transparency, because feedback that Kevin and Carly and I get is, Kerry, I applied in November, but I didn't hear anything all of December, and then even in the beginning of January. The reason is there are a lot of you and not as many of us, and we have a very long period of application screening because we read word for word every one of your applications. So the critical dates are below, but November 1st through November 12th, the application for the Stanford Nurse Residency Program will post. It is one link. You apply to the Stanford Health Care Nurse Residency Program Clinical Nurse 1 position, and within that application, you select your specialty by preference. Rather than applying, I'm going to apply to the trauma ICU and now I'm going to apply to ortho, you don't apply to the unit. You apply to one clinical nurse 1 position, and then within the application, you select your area of preference. Again, we have a long screening period, but then should you have been selected for a panel interview, you will start hearing from Human Resources at the beginning of January. January 3rd to January 21st is when we create and confirm our panelists for the panel interviews. There's a 2-week time frame from January 24th to February 4th where panel and unit level interviews will take place. You will be notified of your day for the panel interview and your time. And then should a manager feel like you would be a really good fit for their unit, they will invite you after your panel interview for a unit level interview, which will take place either that same week or the following week. By February 4th, all of our interviews will be done and Human Resources will know who they will be making offers to. You will hear that an offer has been made probably that following Monday on February 7th. And then Kevin and Carly and their team will work for the next 6 weeks on finalizing those offers and having you come and doing your pre-employment physicals, clearance, and background checks with the cohort then starting on March 21st. So we're going to get down to why I'm sure all of you are here. The application requirements. What do I need to do to apply to the Stanford Health Care Nurse Residency Program? So really there's 4 buckets, 3 of them which you should be able to check off pretty quickly. 1 is you must be a graduate from an accredited associate degree, bachelor's degree or master's degree program. If you went to an accredited online program, you also can apply. You cannot have more than 6 months of full-time experience as a registered nurse. If you have more than 6 months of full-time RN experience, you would then apply to any posted clinical nurse 2 position that is currently on our careers website. If you are working part-time, we ask that you look at the amount of time in hours that you have worked. If you exceed what 6 months of full-time work in hours is, then again, you are not eligible for our program and you would apply to a clinical nurse 2 position. If you work full part-time and have less than 6 months time in hours, but potentially your part-time work has exceeded the 6-month time frame, that's okay. You have still worked less than 6 months in hours, so you are eligible. You also have to have an official graduation transcript date no greater than 18 months from the cohort start date. So our cohort starts in March. You want to make sure when you go back 18 months that your graduation date falls within that 18-month time period. So today we're going to talk about the red part of the pie, which is really the questions that we get most. What do I need to have in my cover letter? What should that look like? What does my resume look like? And what are the other parts of the required application? So cover letter is the first, resume is the second. We also require 2 School of Nursing clinical faculty instructor reference letters. We request your most recent official and or unofficial transcripts. It's okay if you have not graduated at the time that you apply. That is fine. We still ask for your most recent unofficial transcript. And then we ask you to complete the electronic application. So these are the 5 requirements for the application, and I'll go into them in a bit more detail on the next slides. So cover letter. Question Kevin and Carly and I are constantly asked is, what do we need to have in our cover letter? So remember, a cover letter introduces you to us by you explaining your qualifications and your interest in the position. Your resume is going to review all of your technical skills of your work experience and your education, but your cover letter gives you the opportunity to summarize your soft skills, your attitudes, and your motivations. It gives us a sense of who you are and how you would use those soft skills to accomplish the requirements of the position. I invite you to craft your cover letter in the best way to advertise yourself. You may choose to share the following. It is not a requirement. This is simply offering you some examples of what we have seen in cover letters. Individuals tell us, this is why I chose nursing. This is what motivated me into this profession. This is what I have done and or overcome to get to this point of where I am now. It tells your story. People also tell us what makes them uniquely qualified for this role. And that is the culmination of all of your experiences, not just your clinical rotations, not just your healthcare related experiences, but all of them. Your personal experiences, your work experiences, whether they're healthcare related or not, military experience, opportunities, volunteering. It's all of those unique experiences that brought you to this point and make you uniquely qualified for this job. Others have told us, this is why I want to work at Stanford. This is what they're looking for in an organization, and this is what they can offer us. They also share how our values align. A cover letter also gives you the opportunity to say what you would like to do in the future. While a resume is going to tell us of everything you've done in the past, this is your opportunity to tell us, this is where I hope to go. This is what I hope to do, should I be selected to work at Stanford. Really, you want to look at the cover letter as an opportunity to share who you are. Give us a little bit more insight. Look at your resume, which is really kind of a list of all of your past experiences and accomplishments, and say, how can I highlight what I'm sharing in my resume? So Kerry and Kevin and Carly and their team can really see who I am. So cover letter FAQs. How long is a cover letter required? Yes, you must submit a cover letter. How long should it be? As long as you feel is necessary for you. We do not give or take away points based on length. If you're over 1 page, we still read it. If you're 1 page, that's great. If you're 2 paragraphs, that's great as well. How should I format my cover letter? In any way that works for you. We do not give points or take away points for formatting. If you really are pretty crafty and techie and can do some great formatting, that's great. And if you're a little bit more simpler like me, and that's not your area expertise, that's fine as well. Who should I address the cover letter to? I would say make it simple, to whom this may concern, or to the Stanford Health Care Nurse Residency Program. We have a team who reads applications, so it's not just Kevin or Kerry or Carly, so you can make it general, as it's not just one of us who's reading your application. Yes, we read them. We do not have a software application that scans for keywords and then routes those applications. Kevin and Carly get your application to the system. They ensure that you have all of the required documentation, and then they send it our way. So there's no system that routes applications based on scanning for keywords. Should I target a specific position or specialty? Yes, if you are interested in critical care or you're interested in psychiatry, tell us that and tell us why. Yes, please share your work experiences, even if they're not healthcare related. Much of what is required as a clinical nurse, you can gather those skills in a variety of different careers. So if you worked in customer service in the food industry or retail, maybe you did tutoring or education and you've worked with other individuals, highlight that. There's a lot of shared skill that you have that translates into the work that you will need to do as a clinical nurse. Should I share my senior preceptorship experience, even if it was not in adult medicine? Yes, again, there is a lot of skills that you can acquire in community health, in pediatrics, in maternity, in psychiatry, even if your interest is adult inpatient surgery. You can talk about communication, working as a team, dealing with stress, escalation, resolving conflict, including the family and care. There's, again, a lot of experiences that translate into the adult inpatient population. And should I share why I think I would be an asset, or does this come off as bragging? No, this is your time to shine. We make no assumptions, so what we get from you is what we take. So please share with us, this is who I am, and this is why I think I'd be a really great clinical nurse at your organization. Resume. So now we're going to switch gears to resume. Yes, you need to submit a resume. Remember, a resume provides a summary of your experiences, abilities, skills, strengths, and accomplishments. It gives us relevant information regarding your education, experiences, and job-related interests. It tells us what you have done in the past, which hopefully will align with the qualifications of the job that you are seeking. It is your marketing tool to advertise you, your skills, your qualifications that stress the benefits that you have to offer. So when you're looking at your resume, again, how you format it is up to you. The length is up to you. And what you choose to share with us is really up to you. There is one requirement that we ask that you put on your resume, and that is a list of your clinical rotations, the curriculum that's associated with those clinical rotations, the location, and the number of hours. And I'll give you an example on the next slide. So we ask that you share with us your education. So that is your degree, the school where you received your degree, and the date that you completed your program. If you completed a non-nursing degree prior, please feel free to share that with us as well. If you have work experience and or military experience, we ask that you share that with us as well. And if you do, give us a little bit more information. What was my job role or title? Who did I work for? What was my time and length of employment? And what were some of the roles and responsibilities during that time? You may want to say, what did I learn as a Starbucks barista that can really translate into what I will have to do as a clinical nurse? And share with us. Dedicated team player, worked on a high functioning team, managed a stressful environment, had to provide service recovery when a drink wasn't made. Well, all of those soft skills translate into what you will need to do in the clinical environment, just a different environment. If you have volunteered in the past, it could be healthcare related or non-healthcare related. We ask that you share what was your title, where did you volunteer with what agency / supervisor, and then how many hours, as well as your role and responsibility. If you have volunteered, we ask for the number of hours rather than the length of time. The reason is because we give points based on the number of hours volunteered. So we ask that you say, I was a San Francisco youth soccer coach. I worked for San Francisco Park and Rec. Mark Smith was my supervisor. I worked 217 hours and these were my roles. If you have worked at, let's say, San Francisco General Hospital for the last 5 years, and you're like, oh my goodness, Kerry, I haven't kept track of all of my hours, I'm gonna ask you to go back and give us your best guesstimate of the number of hours that you have volunteered. And then if you have done any nursing internships or externships, we ask you to share that with us as well. A nursing internship or externship is outside of your degree related clinical rotations. So this is extra, this is not a requirement for your degree. So again, we ask for your title or your role. Where did you complete your internship, externship, the time frame of that, and what were your roles and responsibilities? So FAQs, yes, a resume is required. We talked about the length. There is no cutoff. How you format it is up to you. A question we normally get is, how should I format the required clinical information requirement? Any way that you'd like. Some people do it in a table, some people just list, but it will look something like this. This is the curriculum, med-surg nursing or pediatrics or maternity, whatever curriculum you were filling. And then this was the location. I did it at Kaiser San Francisco or Marin Health Behavioral Center. And these are the number of hours associated with that clinical location. If you are still completing a rotation, you can just put in progress since you haven't completed, and that is fine. We do not give extra points if you have done a certain number of clinical hours, if you have done clinical hours at Stanford. The reason we ask for this, especially during this time, is we know that COVID and the pandemic has impacted our residents' abilities to secure clinical rotations during their nursing school preparation education. And so when we hire individuals, we look at that and we might say, okay, Kevin Silvestre was hired into the trauma ICU, but he only has 90 hours from his last preceptorship and the remaining were virtual because of COVID. It gives us some insight into maybe some supplemental orientation or training that you may need so we can properly guide you through this program. It gives us insight into how you're coming to us. So if there are any gaps, we are better prepared to fill them. We do not give extra points if you went to a certain nursing school. We do not give points based on GPA or points on degree. You are welcome to share all that information with us. We would love to see all that information, but just know if I went to USF or if I went to Evergreen or if I went to Columbia, there is no rating. If I have a 3.0 or a 3.5 or a 4.0, there's no rating. If you have non-healthcare work experience, yes, please share that with us. All volunteer work is acceptable. We talked about internship, externships. Should I provide my RN license information? Yes, if you have that. If you have secured your California RN license by the time of the application, please share that. If you have not taken your test, that is okay. There is a time frame and a lag, and so we understand that. So please share if you have it. If you don't, that's okay. If you have BLS and ACLS, please share that information with us as well. And then feel free to share other elements should they apply to you. You can share references, additional skill set that you feel like you have to offer, maybe some certifications or any other accomplishments that you would like to share with us. Reference letters. So we ask for 2 reference letters from your School of Nursing clinical faculty. So this is the individual who oversaw your clinical rotation and provided your grade on your transcript. This is not a preceptor that is hired by the hospital that maybe you just showed up and worked with. So it's the individual who works for your school who oversaw your clinical rotation. We ask that when they write this letter that they, their signature line shows their School of Nursing clinical faculty position. If they want to provide it on school letterhead, that is preferred, but it's not a requirement. And if any of your faculty is saying, what are they looking for? We're asking for them to focus on how you performed in that clinical environment. What were your interactions with patients or peers? Did you provide compassionate care? What is your ability to work as a team? What is your communication like? Any information on if you're flexible or adaptable to change, critical thinking, your ability to prioritize, your ability to provide education, monitoring of patients, resilience, really kind of how you have shined within that clinical environment. Okay, the last part is the electronic application. So the electronic application has 3 main buckets. One, demographic information and some general application questions such as, where did you hear about it? Our program, will you commit to a 1-year residency program? Really just kind of yes and no information. Then there is an opportunity for you to rank. This is where I would like to work. And you will have, I think it's 6, 1, 2, 7 options, excuse me, for this application. And there will be instructions and it will say, here are the 7 specialties in which we are hiring. Please rank by order of preference, 1 through 6. So if I really want to work in critical care, that's going to be my number 1. And then if clinical trials is my number 2, that's what I'm going to put. You will rank 1 through 6. Our goal is to place you in a panel interview of your top 2 choices. And then you will have electronic application questions, and there will be 4. You will be required to answer all 4 of these questions. You will notice that there are multiple components to each question. You are required to answer all components of the question. The length of your answer is again up to you. We accept all answers regardless of length. These questions are really the meat of your application. This is where the majority of the points are allotted to these questions. These are the questions that you will see on the March 2022 application. We're going to go through them in a little bit more detail, and I'm going to give you some examples. So you will notice that there are 4, and you will notice as you read them, there are multiple components in one question. So for example, let's take the first one. Tell us about a time during your clinical rotation when you experienced a caring moment with a patient. That's part 1. How did this moment affect the patient's outcome? That's part 2. And how has it changed your clinical practice? That's part 3. So when you answer these questions, you will notice that a lot of them are asking you to share a story and the result of that experience. We do not score that portion. That is your story that you are sharing with us. What we do is have a rubric, and it says, Kevin has applied to us. Did Kevin tell us about a time during his clinical rotation where he experienced a caring moment? Yes. Great, he fulfilled that bucket. Did he say how this moment affected the patient's outcome? Excellent, he filled that bucket. What we are looking for is the third component. How has it changed your clinical practice? What is Kevin telling us about his ability to grow, learn, and adapt? How has he incorporated what he has learned into his current practice, or how is he going to change going forward? It's giving us additional insight into who you are and how you take a past situation and change it and move forward into a similar future situation. What have I learned? What has been my growth? mindset. So when you read these questions, focus on the bold. You still need to answer the other parts, but that is your story. For example, number 2, tell us about a time you had an error in judgment. It could be anything. It could be a personal experience where you ran out of gas. It could be that you forgot to pick up your kids from the bus stop. It could be a professional experience when you worked at a previous job as an accountant, or it could be during nursing school where you did not contribute to a group project. Whatever story is, that's your story. What happened? Did they tell us what happened? What did you learn from this experience? Did they tell us what they learned? How has this experience shaped you into the nursing professional that you are today? So focus on those bold and underlined points. That is where we're trying to get to know you. So my recommendation is to take these questions, think them over, and spend some time answering them. And then when the application opens, you've already written your answers and you can seamlessly just upload your answers into the electronic application. So let's look at the first question. Tell us about a time during your clinical rotation when you experienced a caring moment with a patient. How did this moment affect the patient's outcome? How has it changed your clinical practice? So part 1 is tell us about the experience. That can be any experience. These are just examples. I sat with a concerned family member. I stayed with the patient and offered comfort during a procedure. I took a patient on a walk to the gardens. I washed and styled a patient's hair in anticipation of their family visiting, et cetera, et cetera. Any experience in which you feel you shared a caring moment with a patient. How did this moment affect the patient's outcome? The family member felt relieved and calm. The patient felt supported and comforted and verbalized that the procedure was much easier. The patient verbalized feeling refreshed and beautiful, etc. You're simply saying this was the experience and this is how the patient responded and letting us know what that outcome is. The third part is saying, how has it changed your clinical practice? You may want to ask yourself some questions. What did I learn from this interaction? What do I do differently now? Is compassionate and caring care now a proactive part of my practice? I just do it rather than maybe reactive, waiting for someone to request. What did this moment teach me about human to human connection? Has my viewpoint shifted from patient-centered to person-centered care? Do I now incorporate the family as an essential part of the team? So think of your experience and ask yourself questions to determine, what do I do differently now based on that experience? So here are 3 examples that I have created to give you some idea. So same question. So first answer, during my labor and delivery rotation, I had the opportunity to work with a Mandarin speaking patient. I do not speak Mandarin and therefore use the interpreter services provided by the hospital to communicate with this patient. When the interpreter was not present, the patient became anxious as she did not understand what was being said around her. I approached her and grasped her hand, looking her in the eyes and partnering with her in doing some slow breaths. The moment I held her hand, she smiled and appeared calm, more relaxed than I had ever seen before. I stayed with her for the remainder of my shift, offering my physical presence as support. When the interpreter returned, the patient thanked me and told me I was of much comfort to her. Great story. Thank you for sharing. Check. Showed us how the patient responded. Check. But did not tell us how it has changed their clinical practice. This answer does not meet the expectation. Now let's look at number 2. So you see that that third component is missing. So we're going to look at number 2. During one of my early clinical rotations, I took care of a patient with a poor cancer diagnosis. After hearing her prognosis from her doctor, she was visibly saddened. I have never cared for a patient with a poor prognosis, so I felt like I was lacking the appropriate skills to adequately comfort this patient. I decided to stay with the patient and offer to hold her hand. She asked me questions about nursing, where I was from, my passions, and I freely shared this information. I found that sharing a bit about who I was allowed us to connect about personal similarities. We spoke of our love for animals and even laughed about stories of our dogs and all the trouble they got into. This interaction served as a much needed distraction for the patient, and she was visibly more cheerful after I left. I learned that sometimes your presence is all a patient needs, and now I make a strong effort to offer my physical presence, even if it's just a smile or a wave, with all patient interactions. So told us the story, check. Told us how the patient responded, check. And then provided, and not a lot of detail, but some detail, how it has changed their clinical practice, check. This meets expectations. So now we're going to look at one more. During my senior preceptorship, I was caring for a post-lung transplant patient who had a very complicated surgical and hospital course. The patient had a trach and was not able to speak audibly. Despite many attempts with the speaking valve, it was apparent that the patient could not tolerate the speaking valve and therefore relied on writing on a whiteboard to communicate with his care providers. I had the opportunity to care for this patient multiple times and always found him extremely cooperative and motivated in his care. On one shift, I noticed he was more withdrawn and less engaged with his plan of care. I inquired if everything was okay, and he wrote, "I am feeling frustrated." He continued to write that he met his wife on the 16th of February, 1968, and since then, he had brought his wife flowers on the 16th day of every month. He knew that tomorrow, March 16th, he would not be able to continue that tradition. In that moment, I came up with a plan. I told him I would bring flowers tomorrow so he could give them to his wife when she arrived. I gave him a blank piece of paper and some colored pens and asked him if he wanted to write her a handwritten card. He immediately smiled and wrote, "You bet I do." His whole face lit up. The next day when his wife came to visit, he presented her with the flowers and card, and she immediately burst into tears, happy and grateful tears. The patient was genuinely happy and expressed gratitude for the thoughtful gesture. He said it made him feel seen and cared for and helped him recommit to his recovery. This caring experience taught me the power of small acts of kindness, the importance of taking the time to recognize your patients beyond their disease process, and how important it is to care for the whole person so they can show up fully to their own recovery. Since this moment, I have committed myself to seeing the human spirit in each patient, and in doing so, have embraced each patient as the unique individuals that they are. I connect with each patient, ensuring that I call them by their preferred name. I proactively involve them in their care, sharing with them the goals that the care team has for them, but also ensuring that we acknowledge the patient's personal goals as well. I respect their preferences and validate their concerns. I make no assumptions. Above all, I foster a relationship built on trust, kindness, and genuine care for my patients, with the hope that they know that I am here to care for them as people, not just as patients. So in this answer, they told us the story, check. They told us how the patient responded, check. And then they gave us a ton of insight as how it has changed their practice, check. This individual has exceeded our expectations and then will be scored as exceeds expectations. No generalizations. They told us exactly what they do. They call them by their preferred name. They tell them what the plan of care is. They incorporate their individual goals as well. They respect their preferences. They validate their concerns. They don't make any assumptions. They're literally telling us exactly what they do so we can see it. So my recommendation is when you share your story, focus on that third component piece that's underlined in bold and give us more insight. Really show us how you are changing, growing, learning, or how this has impacted you. And give us examples, simple examples. This is now what I do to really show that growth mindset. Before we close, just a couple general FAQs that we get. Can I apply before I graduate from my program? Yes, you can. Can I apply before I have my RN license? Yes, you can. You must have your RN license or a confirmed test date by February 26th for the March cohort. Can I choose my specialty area? Yes, we talked about that. The interview process. So the interview process will be a panel interview process in which you will interview in the preferred specialty that you have selected. Kevin, Carly, and I will host an interview preparation webinar similar to this to give you more information on what that will look like. Likely that will be at the beginning of January timeframe. How many people are we hiring? We are looking to hire around 100 for the March cohort. If I have applied before but was not selected, can I apply again? Yes. please do. We do not screen your application differently if you have applied before and perhaps did not get selected. We invite you to apply again. So I have talked a lot, so I'm going to pause. I'm going to turn it over to Kevin to share some questions, and I'm going to invite all of our panelists who are on the call to please share in response to any of these questions. Kevin, I don't know if you're muted. I don't hear him.
1 second, guys. Technical difficulties. Be right there. Hold on.
I was like, where did he go?
I'm going to step in for Kevin.
Okay,
He's having
thanks,
some Zoom
Carly.
issues. So we are going to get started on answering some of these FAQ questions that keep coming in. And I'll be speaking kind of on behalf of Kevin and I. So hi, everyone. I'm Carly Dye. I am the Senior Talent Strategist here, and I help Kerry and Kevin kind of with this onboarding process. So there's been a lot of different questions in here, so I'll try to keep track. And if these don't all get answered, make sure you go over to our Facebook as well, because a lot of them we list out as well to make sure that these questions get answered. And if you have questions about the Lucille Packard residency program, Kevin just entered into the chat the main contact for that program. We obviously don't do OB and PEDS over here at the main hospital. How many cohorts will be started in 2022? We will have 2. We will have one in March, and then I believe the second one is in August. Is that correct, Kerry?
Yes.
Correct. For the reference letters, for all of your reference letters, please make sure that they come from your clinical instructor on the school letterhead. There will not be exceptions made. No, it cannot be from your preceptor, from your current employer. It has to be from your clinical instructor, and your clinical recommendation letters will be uploaded into the application system when you go to submit those. It has to be 2 School of Nursing instructor reference letters. So just make sure that you have those 2. If you have an issue, obviously with COVID, there's different issues going on. Please feel free to reach out to us at newgradrn@stanfordhealthcare.org, and we can go through kind of on those case-by-case basis. But overall, you have to have 2, and they need to be from your RN clinical instructors, not instructors from outside of the RN program. Let's see.
So I saw a couple, Carly. So yes, we accept individuals who have graduated from all nursing programs within the United States. This asked about programs outside of California. You just need to have your California RN license or your California RN test date. There was a question about ADN, individuals who have graduated from ADN programs. Do you have any recommendations that will allow us to stand out from applicants who have a BSN degree? So your curriculum in the ADN program is incredibly robust, and your clinical rotation hours are either equal or exceed your BSN or MSN colleagues. So you are very well prepared to enter this program. If you are from an ADN program within the Bay Area, I've actually spoken to all of your directors or deans and have looked at all of your curriculum. And if we didn't feel like we could support you or you wouldn't be successful, then we would not likely have opened these doors, but you are very well versed and prepared. So I would say come, share your story, practice your questions as I would for all of you as a recommendation, but I think you're very well qualified.
I saw a couple of people ask if they're able to check the status of their application. The main thing you'll be able to see is that you've completely submitted your application and you've submitted all documentation needed. Unfortunately, from there, because of the amount of applications that we get, we aren't able to let you know individually where your application is in the process. You just kind of have to wait out through that timeline to see if you are selected for an interview.
So Carly, I'm just going to ask our new grad panelists, and Edward, I'm going to put you on the spot since you have helped us before to kick us off. Can you provide some insight into what made you successful in your application and interviewing preparation into the program? And then I'll let the other nurse residents speak as well.
Yeah, absolutely. Can you hear me okay?
Yes.
Perfect. Hi, everyone. My name is Edward. I am in cohort 33, so I started October 2020. So can't believe it's been a year. I started on C2, which is medical oncology, like solid tumors. I recently just transferred over to E1 with Shane, which is BMT, CAR-T, bone marrow transplant, and more of the hematologic cancers. So yeah, it wasn't too long ago that I was part of this process, and I do recall it pretty vividly. I think the biggest piece of advice I can give to everyone that I think helped me be successful in preparing and interviewing and answering the questions is brainstorming patient experiences that you had that were really deep, were really meaningful and rich. I say that because I think it's tempting to often look at all the nursing questions that people ask, Googling like, what are the most common nursing questions, looking at Facebook groups, what do people ask? And when you do that, definitely you'll be able to cover a lot of questions, but in the end, we never know what's going to be asked of us. And you could list a million questions and have answers for each one, but you're not going to remember what you wrote, what you prepared for each one. Instead, I found it meaningful to think of these experiences that I learned a lot about. I could talk about just off the top of my head because they stuck with me. They were impactful for my patients and the care that I provided. They were impactful in what I learned and what I took on with me to my next patient. And from there, you can talk about those experiences with many different questions. So I remember there was a slide that Kerry had shared that showed all the different aspects of nursing, like, I don't know if Kerry, you still have that slide, but it was like delegation, critical thinking, just the core aspects of nursing. And when you have these really great experiences with patients, you can fit those experiences across many buckets, and you don't have to worry so much about individual questions. But when they ask about conflict resolution, you can talk about a patient who had a really complex case, and maybe the provider ordered something that wasn't correct or you were unsure about, and that could answer that question. Or it could be a question about, tell me a time when you provided care to a really complex patient. How did you prioritize your care? And that can also be used for that question. So that'd be my biggest advice. Just really think through. I had 7 to 8 patients that I just could talk about, and I just knew them really well, the circumstance, what I learned, and applied those to different questions that were asked, and they were versatile. And I think that helped a lot.
Thanks, Edward. Meley, any insight from you on successful application preparation?
Okay, hi everyone. I'm cohort 35, currently working in K4 transplant. So one of the best is that I would give is definitely, like Edward said, early preparation is key. If you're doing your application last minute, it kind of just, you tend to forget things. So if you do it early, you are going to remember like the experiences that Edward was saying that you need to have. So you can talk about like, this is what I did. And also, to write all your letters nicely. Like you can tell an application that was written, like the night before versus like somebody that put a lot of effort into it. And then also researching the company that you're working for, like it matters to, for you to see if it's a good match for you, as well as just what the hospital is all about. And specifically with Stanford, knowing their vision, their mission, the goal of the hospital, and then also the vision and goal that Stanford has, kind of just understanding like what really that means. And then also knowing yourself. What I mean by that is just being authentic in your interviews is key. Everybody is going to be telling, the hiring managers, I did this experience where I worked as a CNA. So you kind of have to think about what is it that about me that is unique that I can bring to the table. And that comes from really knowing yourself and also trying to think about experiences outside of the clinical setting. Of course, the ones in the clinical settings are very
We're losing you a little bit,
if you like,
Meley.
I don't have enough clinical experience to talk about. Sorry, my connection is so bad in this room.
That's okay. You're
Let
back.
me know again if I mess up. Okay. So if you feel like I don't have a lot of clinical experience, don't worry, because those outside experiences that are not clinical also count. It's just a matter of how you talk about them. So that's what that all is connected to that early preparation. You can think about, you can write down, like for me, I had like a Google Docs where when I was first starting a job application, I had all the questions I was asked, I would just write them down, and I will kind of just build up on that, trying to make them like the answers better, or to see if I can add any experiences, and also ask, people, your friends, like, what is that you like about me? Or, if you have a hard time kind of just trying to figure out what your strengths and weaknesses are, and being able to articulate that to management. So it's not about like what you did in the clinical setting. If you saved somebody that's coding, that's not really what they're looking for. It's just more about, are you a safe practicing nurse? Have you shown that you're dedicated? Are you resilient? So anything that you can think of that can fit into these key words also helps. So kind of just, I think being authentic is like really one of the things that I would really advise you to like work on.
Thanks, Meley. And Meley, when she first started talking, it cut off a little bit. So she's in our most recent cohort 35, and works in one of our critical care, K4, which is the trauma surgical ICU. So I know that cut off from the beginning, so just want to provide that. So Afreen and Shane, any insight or advice on how you answered the questions, how you chose the stories to share, and how you provided that additional level of insight in your application?
My name is Afreen Patel, so I'm in cohort 35. I work on liver and kidney, the surgical floor, liver kidney transplant. So for me, what really worked is the essay portion is the most important part, those questions that they're asking you. So I broke them down, each question, into 4 components: the situation, task, assessment, and recommendation. So recommendation is what Kerry was saying, how you self-reflected, your intervention, and what you recommend for the patient in general. So that is the meat of your whole application, and also the interview process. So when you sit down with your panelist, when you do get called for the interview portion, you really want to show your critical reasoning skills. And by that, I mean is always reflecting on what you can do for the patient, what you're thinking, and verbalizing it out loud. Because at the end of the day, these managers are hiring you and trusting you to be on the floor, to be an independent nurse eventually. So they really want to see how you work through problems. And that's the goal of this 4th component, is really thinking about, how am I going to help my patient? Am I a patient advocate? What does that mean for me? Or am I an advocate for myself? When is the time that I've advocated for myself for nursing school or in a different job? So a lot of these things are not your actual nursing book to book understanding of disease and prognosis. It's more of your soft skills of how you stand up for yourself, or you stand up for your community, or a time that you took on a challenge, and you really want to reflect on that and really build on that, because those soft skills are really going to help figure out if you're going to be successful at Stanford or in the inpatient unit in general, because you're going to face challenges every day as a nurse, and you're going to be placed in new situations, new problems. And it's not your understanding of the disease and prognosis that are going to make you successful. It's how you problem solve. How do you reach out to your charge nurse? How do you reach out to your manager? Those are the things that are really going to set you apart. So you really want to build on that and self-reflect. Talk about a time you've communicated with the provider, you communicated with your charge about a situation, or how you've delegated in the past, or how you've escalated a situation and worked through the chain of command. So those are things you really want to sit down and think about. And I also would say is work with other people and verbalize your answers, and what sets you apart, what makes you strong, because someone else can see something else about you that sets you apart. Maybe you're very patient, or maybe you're very, very easy to talk to. These things you want to pick up and bring that to your interview, because you may not see it, but maybe a family member sees it, or a friend sees it, or an advisor. So you can use that to your advantage in your interview and talk about that and verbalize it, so that your managers can see that you're able to understand things and bring in your strongest components and your weaknesses to Stanford. So that's my advice.
Thanks, Afreen. Shane, additional insight?
Howdy, can y'all hear me right now?
Yes.
All right, awesome. First, I just want to say it's very lovely to see a bunch of future coworkers here in the Zoom call. It's very cool to see people that we'll be working with in the future. And to kind of go back to your question earlier, Kerry, about where do you start, right? How do you decide to find these stories or talking points to bring up in these prompts or in these interview questions? And that's a really difficult place to start with, right? And I would really encourage everybody to go back and reflect and dig through some of their old nursing school assignments, especially those clinical reflections that some of your preceptors may have made you do, or some of your professors may have made you do. Those are really valuable resources. All those little homework assignments where you kind of had to be a little bit more mushy-gushy about your clinical experiences or how patients affected you. That's going to help stir up some memories about your experiences, because I know when I first started this experience, I was like, dang, how can I remember about all these clinical experiences when I can barely remember what I ate for breakfast yesterday? So that's a really difficult place to navigate. And the best way that I would recommend kind of navigating through all that would be going back to your homework assignments, because that's a really great resource to use. And your nursing schools were thinking ahead when they assigned it to you, for sure. And then kind of going through the whole process of going through the new grad application process. There's three things that I try keeping in mind that somebody encouraged me to think about, and I would like to impart onto all of y'all. It's 3 R's. The first being reflect, kind of talked to that about already, being really reflective and introspective about your experiences up until this point. The second one is rehearse. You've already done all the work. Now it's just kind of putting it to practice and polishing off so that you can really shine as bright as you can for others. And then the third and final one is redefine. When you do eventually get into the position of being a hired and employed registered nurse, you're going to find yourself having moments of doubt, and that's okay. You are very capable. You've made it this far. I know I struggled with redefining my understanding of myself of being a really good nursing school to being a really good nursing student to being a newbie, new grad, still trying to learn how to be a nurse, and understand that it's okay, that this is a really great infrastructure for you to learn and grow in, and that the expectation when Stanford hires you is that you are an extremely valuable talent, and they see you being an incredible nurse down the line. They don't expect you to be the super duper nurse immediately right off the bat, but that you'll be amazing later down the line.
Thanks, Shane. So we have a couple questions in the chat for our nurse residents, and I invite any of you on the call to come off mute as well and ask questions. So the first is to the current nurse residents: what do you like best about being a Stanford nurse? Take it away, Edward. I see you smiling.
There are just so many amazing things about being a nurse at Stanford. I think my absolute favorite part is the depth of resources available to us in every aspect possible, whether it's just like academic literature that you want to study and read up on, or shadowing experiences. They don't expect you or force you to stay in the same area. If you start in one unit and you realize, hey, I actually want to seek out a different unit, managers are really open to letting you shadow and even pick up a shift. and see what it's like on that unit. I love the resources we have in our colleagues. The nurses are constantly teaching each other. We have, nurses who've been here for 20, 30 years, and then we have the residents and the attending doctors who are generally really receptive to questions. So I love that academic aspect, the teaching aspect. It's a teaching hospital, and it's okay to not know. It's okay to ask questions, and you will find your answer somewhere. Someone will have it, and the support is just is really great. We have a strong union. Join the union.
Others, Afreen, Shane, Meley.
So to add on to what Edward said, since Stanford is an educational facility as well, they're open to you guys asking questions. So never be like, for example, in my unit, we have 2 unit educators that are dedicated to just educating nurses to be, better practicing professionals. So any questions that you have, you can always ask them. And also there's opportunities to participate in like educational seminars that you get paid for. So it's just different resources. And even like the doctors, if you're a new grad student and you're asking them questions, they're very open to like educating you about things. They don't, at least for me, like I haven't ran into a doctor that was like not willing to educate. So that's why it's always good to be part of an organization that's also a teaching facility, because that's like their main thing that they will stand up for.
Hey everyone. So the advice, I mean, not advice, but what I love about Stanford in general is that for me, it was very important to feel supported at an institution. And, we know the certain circumstances that we're in with COVID pandemic and how nurses, are burnt out a lot of times. And for me to come into an institution, I wanted to make sure that I'm comfortable and I can ask questions and I can feel supported and feel safe as a provider or as a nursing professional. So for me, those things Stanford checked off, and I verbalized that when I was in my interview as well. Because remember, you're interviewing at Stanford, but you're also interviewing them to see if they're a good fit for you. And you want to make sure that you voice these things in your interview, what you want. Like I want to feel supported. I want to feel like I can go to my managers with questions. I can come to Kerry if I need something. And Stanford provided that for me. And that's very important, to understand what you're looking for and bringing that to the interview and bringing that to your job as well. So I'm lucky to be on a unit where I can ask questions and I can tell them, this shift didn't go that well, but this other one went really great. So it's important to self-reflect again, but also share and communicate that with your managers. So building that relationship, I'm very fortunate to have that.
I'm going to switch gears, and maybe Shane, you can start us off. So question is on, what challenges did you face starting as a nurse resident and new graduate at Stanford? How'd you overcome those challenges?
Yeah, I think the number one challenge, and this kind of goes to a question I saw in the chat from Emily, with sort of maintaining a good work-life balance. I think that's something that every new grad, whether it be here at Stanford or any other program in the country, is learning how to keep work at work and be your happy, most fulfilled self once you get back home. And that's like a really difficult thing, because you're in this constant state of learning and growing and overcoming challenges. So that takes time. There will be growing pains that you have to sort of work through. And that's why we have such an incredible program here to sort of provide infrastructure and check-ins, whether it be through management, with folks from the new grad program, even your unit educators, your preceptors. They all kind of have these little scheduled check-ins to make sure how are you learning sort of in a professional academic sphere, and also an emotional and holistic way as well. That's a really important, valuable thing that I think this program offers, is care for the whole person, cure personalis for all my USF dons out there. And so that's something that I struggled with a lot, and I've learned to grow and work through. I saw another question about sort of work commitments. Typically nurses at Stanford work 3 shifts of 12 hours in a week. And usually they're, depending on the staffing, they can be kind of clustered together so you can have a longer break off so that you can have a longer extended time with family or friends or do something fun a little bit outside of work.
Edward, any thoughts on challenges that you encountered in starting and what you did to overcome those?
I think a common challenge in my cohort, and just I remember when everyone was applying, was just thinking about how COVID affected our experiences. I see a lot of questions around that right now in the chat box about like how that will affect your resume and how that looks. And I recall that being, I don't know, just a source of anxiety. And I would just encourage everyone to rest knowing that Kerry and the team, they know that that's a baseline, that people's clinical experiences have been affected, and focus more on what you did do during that time. That's what I tried to do because I graduated in May 2020. That was when the pandemic first hit. I was actually the only one in my entire cohort who had a preceptorship. So all the other 48 people didn't. Cohort in my nursing school, not in Stanford's program. And I got really lucky. And I talked about that actually in my application about how I went and sought that preceptorship out. I did things that were not recommended, like going to managers in hospitals and trying to network that way. But that was what I tried to do. I tried to elevate, like, what did I do during this time where things were challenging and a lot of doors were closed? What doors did I try to open and what did I pursue? I even worked at a SNF for a little bit because I was like, well, no one's going to hire during this time. So I tried to take a deep breath, think about what you did do to shine during this time, even though the pandemic did affect all of us, and talk about the experience and how you overcame that, because that shows a lot of resilience that Meley was talking about, and showing how to problem solve and be creative in making the most of our situation. And that shows a lot to managers about how you will be as a nurse down the road.
Meley, question for you. What skills do I need to be a successful new grad in the ICU?
But the main ones are, so if you guys remember, like in nursing school, we used to talk about prioritization, delegation, those come in handy. So it kind of just goes back to the basics, honestly. So for me, the main skills that I felt were really helpful was prioritization, knowing how to delegate and knowing how to ask questions. Because in the ICU, for example, we're new grads, they don't really expect you to be able to solve the problem like a patient's presenting was at the moment, but they expect you to be able to prioritize that he's deteriorating. What do I need to do? And you should have a top 3 things that you could do. The same thing when you're giving out meds, what meds can I give? Like, priority wise, which one is a priority med? Or if the patient's presenting with different type of conditions, because most of these patients, it's not just one problem they have, it's multiple. So kind of just outlining when you start your shift, what are my goals for the day and specifically for that patient. So if you're be concerned about their respiratory problems, is that going to be a priority versus cardiovascular? So understanding that. And the second one is being able to delegate. You have past nurses that will be helping you. And there's also other nurses on the floor, like in my unit, everybody's very helpful. So if you feel like you don't know how to do something, or you want to, you're stressed out in one room and you want to just delegate a task to your FAST, for example, you could just tell them, I'm really busy in this room. Is it okay if you can help me? So being able to delegate. And for me, it took me so long to kind of practice that skill, because you feel like, well, like I want to do everything by myself. They expect me to do everything by myself, but delegation is a skill that you need to practice to be successful, because you can't do everything by yourself as like a new grad. It kind of takes practice. So knowing how to delegate, knowing when to delegate, being able to prioritize with everything, medicine, like giving meds, answering to any type of emergent calls, and then also asking questions. If you have the slightest doubt about something that you're either putting into the patient, taking out of the patient, you should definitely ask, because once you do it, there's kind of no way to reverse that. So asking questions has saved me so many times from making, like medication errors or just other things. So those are my 3 best advice that I would give you to work on. And it's going to be challenging. But the more you are on the shift, I think you will tend to practice how to prioritize, how to delegate, and how to ask questions. So those are the main things I would advise. And last but not least, also, if you can look up the clinical reasoning cycle, that also kind of helps you, I guess, process things. So that is like more in depth when in class, the stuff that we learned, but the clinical reasoning cycle, if you just look it up on Google, it gives you insight into like how to kind of care for a patient. And also there is something called behavioral interviewing cycle, which I forgot to mention earlier. That is literally what I use to answer all my questions, and it kind of hits the points what a nurse should be, an advocate, an educator. Everything a nurse should be is in that behavioral interviewing cycle. So those 2 things, if you can look them up, I think it will help you a lot.
Thanks, Meley. Feedback from the residents on what made you successful during your panel interview or unit level interview.
I think for me, it was just showing your personality really, because especially the first round when you're with other nursing residents interviewing and answering the same questions, it can get a little intimidating, and that's okay. It's okay to feel a little intimidated. It's okay to feel like, okay, I'm competing, but you're really not, because all these managers are looking at you and they have different types of units. They have different unit cultures. So you might find your fit somewhere else and another person may find their fit another place. So think about it just as in what you're doing in your lane. Think about your path and try to answer the questions to the best of your ability with the experiences you've had, and let yourself shine. I would say show your personality. And if you don't know the answer to something, it's okay to say, I don't know. Nursing, there are things that we don't know, but we ask for help. We go to people that are the right people, like our charge and our resource nurses, to find the right kind of help. And that's okay to feel that you need a moment or take a breather and really think about what you want to answer. So that's my biggest advice, is just let your personality shine. I know your nerves will get the best of you, but it's really important to take a deep breath and just do the best you can. It's okay. So that's my best advice. And I use the same Zoom background. I wanted to do this on purpose so you can see it's a blue background with natural light, and I'm looking like right at my laptop. So this is the same background and same setup I used for my interview with Stanford. So.
Yeah, it definitely takes a lot to adjust to the new Zoom format. We're probably used to in-person interviews. So I'd say definitely prepare by having a quiet space with good internet connection where you can have uninterrupted time with their recommendations with like a solid background, things that aren't too distracting, things like that, or looking into the camera, because often we look at the screen and therefore you're not really making eye contact anymore. It depends. There's probably no like rubric or points that are being scored on that, but definitely still like dressing appropriately as if you were in an in-person interview. I don't know if we went over the format, but briefly, there will be the same questions asked to everyone in the panel, but the order in which they are asked changes. So you will be the first to answer one of the questions, but for the other 3 questions, you will hear the questions asked to the other candidates first. I don't know if that will change. Kerry can speak to that. But I would recommend definitely having your answers prepared, your experiences like we talked about, the ones that are really meaningful, but also listening to the other candidates and, maybe even nodding to them and speaking to them like, oh, what so-and-so said really resonated with me. It just shows that you're listening, that you are engaged, and that you care about what other people have to say and how that can even enrich or add to your answer. And after that, Kerry said your specific unit will reach out if they want to interview you. And that will just be you with the manager, probably assistant manager, clinical nurse specialist on the floor, and maybe a veteran nurse. So there'll still be multiple interviewers, but it'll just be you answering the questions. That one's much more intimate. You'll have time to ask questions, whereas during the panel interview, you won't really be able to ask questions. It's more just go around in a circle. And it's just more personable. You can talk about your goals and your dreams and what you're looking for and whatnot. And then Shidi, I saw your question about BMT. We can touch back on that after people speak to the interview process.
So the interview process, similar to what Edward said, it's a 2-step Zoom with panel interview. For me, the same things I've told you guys before. What helped me prepare for this interview is preparing my materials early on, keeping those stories, because they will ask you questions. Tell me about a time. So the more stories that you have prepared, so kind of flashback into nursing school, all those experiences you have, even if it's small, you learn something from it. Writing those down helps. So early preparation and being really authentic and unique with your answer. Yes, you should listen and engage with other panelists that are interviewing with you, but you should not compare your answers to them because your experience is your own. And so I remember actually Kerry gave us that advice, and she said, like, don't pay attention, but don't think, oh my God, my answer is not like them. I didn't have an experience in the ICU. Don't think that, because they're not, I guess, picking applicants based on, oh, so-and-so went to a different school, they had this GPA, they worked in the ICU before. They're basing it off of, again, are you going to be a safe practicing nurse at the end of the day? So by kind of keeping in mind the clinical reasoning cycle I told you, the behavioral interviewing cycle, it kind of will help you gear your question on how to answer it without going off tangents, because these interviews, they have a time that they want to finish by, so you don't have a lot of time to answer all your questions. But if you're following that behavioral cycle, it tells you kind of as an advocate, nurse as an advocate, what did you do that showed you being an advocate? So it's very self-explanatory. So I did that. And then also understanding the vision, mission, and values of the organization you're working for is also important, and kind of try to tie that into your interview. So, and then again, I would like to emphasize, just really try to be authentic. Don't try to be somebody that you're not. Don't try to copy somebody else's experience. I think just bring what you actually did to the table.
I'm going to ask the panelist, how did you choose your specialty when you applied and had to rank? What thought went into that?
So I can chip in real quick. I never thought about oncology as a specialty throughout my nursing school experience. It wasn't until I started working at Stanford as a nursing assistant, working on Unit C2 along Ed, working with some solid organ oncology patients, solid organ tumor oncology patients, and being able to be around folks a little bit longer, that became very impressionable. And I would encourage everyone who's trying to do their self-discovery about what area that they would want to go into. Think about your experiences, whether it be through the nursing program or the experiences that kind of directed you towards your nursing career, whether that be a family member or a Grey's Anatomy episode, something so, or anything along those lines, or previous work experience. What makes you the happiest, and try to find some sort of tangent connection to a specialty, right? Like if you like talking to people and get to know people really well, oncology is a great fit for you. If you like to use your brain and be a super duper brainiac, critical care is going to be your place. If you like to be a jack of all trades, doing med surg or float pool, that's going to be an awesome choice for you too. So the great thing about Stanford, there's something for everybody. And we have plenty of different characters, which all of you will find your little niche for sure.
Afreen, you want to chime in on how you chose your specialty?
So for me, I did my clinical rotations on a liver and kidney transplant floor. But for me, what I would say is that it's really important to look at your skills and look at what you can bring to the table and really shine that in the interview. Because when you're doing the panel interview, you never know which unit that you'll be a good fit for. It may be something completely different. Maybe cardiothoracic will call you for an interview and you've never had a clinical rotation in cardiothoracic. But it's also the way you're going to work with the people on the unit and how you'll be a fit for their unit culture that makes a difference as well. I would say just keep focusing on what your passion is. If cardiac is your passion or if transplant care is your passion, then keep learning about that specialty. And if that's a good fit for you, then that's what will work out at the end. But I would say find a passion and just talk about what actually intrigued you into nursing. For me, I really thought transplant, I loved the pathophysiology behind it. I thought it was fascinating to me. So I really talked about that during my interview as well. So talk about your passion, and that's what will drive you at the end.
So we have about 1 minute left, so we are going to wrap up. I want to thank our nurse residents for joining us today on their day off and providing some insight. I know we could probably speak for hours and hours, but I appreciate all of your questions. And then I appreciate the nurse residents for supporting all of you as they have recently walked in your footsteps, but also serve as a testament to you will find the place that you are meant to be and do the work that you want to do. So whether it's Stanford or another residency program, we wish you all the best. I do want to make a couple notes. This recording, for those who jumped on a little bit later, Kevin just put the link. It will be uploaded within the next 24 hours. So if you want to jump back on, if you missed anything, please feel free to do so. Check out our external website. In January, we will have an interview preparation webinar to talk about what that panel interview will be like in more depth. We will record that as well and post it. So that will be coming in January. So more to come on that. I am going to ask you all to take about 10 seconds. I just put it in the chat. We like to gain a little bit of information on who comes to our webinars and anything we could do differently. So if you could fill out a very quick survey. And I thank you all for joining us. I love seeing these faces. Congratulations on being in nursing school. For those of you who have graduated or with upcoming graduation dates, congratulations. That is a major accomplishment. Best of luck with all of those NCLEX tests. You will do magnificent, and I wish you all the best. Hope to work with you and that our paths cross in the future. Thank you all for joining us. Take care.